have the greatest job in the world, and that's working with dogs.
Best in Show winner is the French Bulldog.
Winston won the National Dog Show. It was amazing. It was exciting. And to have a dog to be #1 dog in this country, you have to have great nutrition. And I always fed Pro Plan. Just like us, when we eat well, we feel good. And I just love that food and what it's done all these years to all the dogs I've bred and all the dogs I've shown.
Welcome to Pure Dog Talk. I am your host, Laura Reeves, and I'm really looking forward to today's conversation. I have Dr. Callie Harris here. She is the basically explainer-in-chief for the Purina's veterinary team. Super excited. She's also works in emergency and urgent care. Like, you know, this is her real gig. And I'm very excited to have a conversation with Dr. Callie talking about, you know, how do we as dog owners interact with emergency and urgent care? What's the difference? You know, all these kind of things. So very excited. Welcome, Dr. Callie. How you doing today?
I am doing wonderful, Laura. So grateful to be here. And thank you so much for even having me as a guest.
I love it. I've been trying to get you for a guest for like, because we met at Westminster in May. So
yeah, May of at least this year, 2024.
Right. It only took me 6 months.
That's it. Hey, this is actually a good thing. This is a good thing. But yes, got a chance to
on target, man. On target.
Yeah. Yes, it's wonderful. No, I'm so glad that we are finally able to get our schedules together. And I'm excited to talk to your audience because your audience is my audience, the pet loving community. Yes. So this is really awesome.
It's excellent. So give us the 411. Tell us how you got to be a veterinarian and then working for Purina and all this stuff.
Okay, I'll give you the cliff notes. So as mentioned, my name is Dr. Callie Harris. I am based out of Atlanta. I'm a very proud graduate of Tuskegee University College of Veterinary Medicine, which is located in Alabama. Very much rich in history and heritage as far as just really pumping out some of the country's best veterinarians, especially from minority backgrounds. So very proud of that. I have been a veterinarian for many years. I graduated back in 2008, pursued a small animal rotating internship.
In other words, you graduated when you were 12, right?
Exactly. Yes, we're tracking here. Exactly. I was a kid. I was a child prodigy. So when I graduated vet school, I went on to do a small animal rotating internship. And for most people, they don't realize that veterinarians, we aren't required to pursue an internship or a residency. We can graduate vet school and get right out into practice. And I wanted some additional training. I knew that I enjoyed some other realms of vet med. And so internship was going to provide that pipeline. And so during my internship up in North Carolina, that's where I got bit by the emergency bug. So this is when the magic started to happen, where I recognized I was an adrenaline junkie. I loved working with really scary, crazy cases. And I also enjoyed being part of the entire team in my exam room with very frantic, scared pet parents. I knew that I could provide not only life-saving techniques, but communication strategies to try to promote calm. And so after I finished my internship, I went back to Atlanta, which is where I'm from, and I became an emergency veterinarian at a very high volume practice in the metro Atlanta area. Now, that's not where my story ends.
Okay, but I want to know if you got like a psych degree to go with your vet med degree.
Working on it right now as we speak. No, just kidding. You know, it's funny that you mentioned that, Laura, because a lot of people think that when you pursue vet med, it's because you prefer animals over humans, right? I hear that
often true. I mean, this isn't like...
But here's the thing. This is what I tell that next generation of vet med or any aspiring veterinary professionals, animal welfare professionals, you know, anybody in the pet care industry, pets are attached to humans. So you kind of have to be prepared to talk to other people because my patients, they don't get in their own cars. They don't drive to the practice. They don't fill out their own history forms. Guess who has to do that? The pet parent. So It's a whole thing. But you probably also want to know, how did I get involved with Purina, right?
Yes.
Because I am a Purina veterinarian as well. So when I was a vet student, I was a Purina student ambassador. So this was an opportunity for me to learn more about the company. I had always known about Purina, the checkerboard, right? I think my childhood pets were fed Purina. But in vet school was when I really started to understand the science and really the investment that Purina puts into the innovations and the research and the quality assurance and the safety and efficacy of the product. And so once I got a little bit of a peep into that, I was like, wow, I am a fan. Sign me up. Very much a partner in this.
But see, here's an interesting side note, listeners that are going into veterinary medicine. I didn't know that was a thing, to be an ambassador for Purina. Like,
oh yeah,
you know, I mean, that's a whole nother piece of the conversation that's like, wow, that's very cool.
yeah. Not every company offers it. I think why, companies like Purina, even some other reputable food brands, corporate practices, pharma companies, why they offer this is because it is a direct pipeline to the future, right? I mean, it's twofold. Like for me as a prior vet student, it gave me an opportunity to learn more about a company in which they're hoping that I'm going to make recommendations, right, of their product.
Sure.
And so I really did get this firsthand approach to, again, the research, the innovations, the science, what goes into just one bag of food that shows up on our shelves.
Sure.
I really got an understanding of the effort that it took to get to that place. And so fast forward to when I became a big time veterinarian, Purina had a position that became available after I've been practicing ER for about 8 years. I was still very much in love with being an emergency veterinarian, but Laura, I'll be honest, I was getting to a point where living like a vampire was no longer as attractive as
definitely living like a vampire. I mean, no question in my mind.
I was a vampire. I worked by night, sleep by day. My reality was very skewed. And so it was time for me to make a transition. And what I really appreciated about Purina then, and still with the company now, they very much encourage me to still put my hands on pets. And so I still practice as a veterinarian on a weekend basis. Yeah, just so I don't lose my street cred,
Well, I mean, so much of what happens on the day-to-day basis, you can't just like make it up. Right.
No, really, you shouldn't. You shouldn't be making these
super bad idea. I love it. Exactly. I love it. Okay. So working in emergency medicine, you've got, I know you've got stories. So like I said, they make whole TV series out of the stories that go into emergency medicine. So just for grins or not grins or something, give us an idea. What was like a normal night for you?
Yeah. I mean, so first of all, it varied, right? Like what happened on a Monday night could be very different than what happens on a weekend night, right?
Or a full moon night. Let's,
or holidays. Or I'm going to tell you, let me tell all of you guys, the nights that tend to be the craziest, like the absolute craziest. Now, for your listeners, I live in the deep South. Okay. I live in the ATL, Atlanta, Georgia, where we don't get a ton of snow. Okay.
Yeah.
You want to see a night where really, what hits the fan is when Georgians or Southerners find out that snow is on the way. All of a sudden,
there's going to be an inch of snow and, hell has frozen over,
Everybody is coming in now for a torn toenail to my cat hasn't looked at food for 5 weeks. All of a sudden, it is an emergency to try to get on these icy roads to come see us. I have never understood it, but that is our busiest nights. So when I think about some of the most like interesting emergencies that I've seen, obviously, there are definitely very critical scenarios that happen. We have to make life or death decisions. Yeah. But some of the more, again, interesting ones are probably when our pets eat things that they shouldn't eat. and when they eat things that they shouldn't eat, and my pet parents come to me very quickly, I can fix that. And typically how I fix that is by making them vomit.
Yes.
So I have had some interesting things come up in dogs' vomit that I'm probably not going to be able to share because I'm sure that this is a family-friendly show.
PG, yeah, PG, man.
PG. And
13,
so
maybe.
okay, so just know that dogs will eat any and everything. And guess what? I love being the hero and making those items come up. So that's been probably some of my most interesting ER cases. Especially when the pet parents find things that come up in the vomit that doesn't belong to them and the family. And you're like, ooh, backpedal, backpedal, backpedal. I don't know where this underwear came from.
I don't own those underwear. I mean, like that.
Yeah. Okay, I am a size 10, not a size 2. What does this mean? Okay, so anyways, I have definitely, going back to that psych degree, I also, act as like family counselor too.
Sure. A little marriage counseling going on here.
All of it. I will tell you another one that has really stood out to me. So as an emergency vet, when I was doing it full time at my practice, I saw dogs and cats, but we also saw exotics. We saw small ruminants, farm animals. I saw everything. I saw birds. And so definitely getting some of my small ruminants or like my goats to come in to see me, those are always exciting. And I'll never forget one patient, her name was Moon Pie. She got into her feed and ate too much. She didn't eat moon pies, but she ate a lot of food. She had a food bloat. I had to induce vomiting and do some things with her to help her. And guess what, guys? As a gift, her family gave me a whole box of moon pies. And so I will never forget my patient Moon Pie that we saved her life one night. And then I got like a lifetime supply.
Okay, I'm stuck on how do you make a goat throw up? Like
you pass the
like
tube.
Multiple stomachs, right?
Yeah, you're right. So you pass a tube. You got to tube them. They're very different from our. Yeah, listen.
This isn't a pour hydrogen peroxide down them kind of thing.
Yeah, you can't do that. Yeah, you can't do that. We're gonna have to tube you. So Laura, the list goes on. I think at the end of the day, I have seen any and everything. And emergency veterinarians, we're definitely like the cowboys of our profession, or cowgirls, or cow people, okay, where nothing phases us. Okay. We will eat while we're looking at a really gross wound. We will, we can just get through anything.
Yep. 100%. So talk to me, and I think this is poorly understood sort of within the community. So talk to me about the difference between emergency and urgent. Okay.
Yes.
Like there's a dividing line, and I suspect I know what it is, but I would love to hear that from you.
Yeah. So let me provide a little bit of context too. So for years, we always had general practice or daytime practices, right? And then they started to develop into creating like a network to take care of pets after hours. And so a lot of practices, especially in like smaller cities, they would, bound together and say, okay, we're going to take these scenarios on an on-call basis to be able to provide care. Then the development of emergency facilities came about. And so now you have practices that are just dedicated to seeing your non-vaccines, preventative wellness, types of appointments. We're really seeing the sick patients. But even then, ERs became over inundated with cases, and there had to be, all of it. Pet ownership skyrocketed. And so over the past handful of years is really when we started to see the uptick in urgent cares in the vet space. And so an urgent care is going to provide that middleman, if you will. So this is going to be the facility that's going to still treat those ear infections, UTIs, vomiting, diarrheas, coughing, your standard, my pet is sick on a weekend or after hours, and I don't know what to do. The reason why you would bypass an urgent care is for those real critical scenarios, such as my pet's unable to breathe, or my pet is bleeding out profusely. My pet got hit by a car. My pet, has a really severe fracture. These are going to be the ones that I would encourage my pet parents to drive past the urgent care and go to an emergency.
Okay, good. That's what I figured it would be, like that, dividing between life and death and just.
Yeah.
Right.
Something else, right. Something else that I would share too, because I also do quite a bit of urgent care relief shifts. Urgent care, we don't tend to hospitalize. So these are going to be like your outpatient, what we refer to as treat and streets. You're coming in, we're going to diagnose, we're going to figure out what's going on, and then we're going to fix the problem. If we can't fix the problem, then we're going to recommend that you go to an emergency facility or see your regular vet maybe the next day.
Okay. So, and I think, like I've seen in my area, and I live very rural, there's only one emergency facility and it's 45 minutes from my house.
Yes.
And they have added an urgent care component.
Yes.
Is that something you're seeing more and more of?
100%. Like, so I mentioned I'm in the Metro Atlanta area. We have a handful of really solid emergency critical care facilities. And I would say like a 15 to 30 mile radius of where I am. So we're pretty lucky in that aspect. Yeah. But even in between all of these ER facilities or specialty facilities, there's even more urgent cares that have popped up. Okay. Just to, again, add more access to pet parents when their pets become sick. And don't forget about like your general practitioners too.
Right. And sorry to interrupt you, but it just, the pandemic to me is where a lot of this just went completely off the rails, right?
I agree.
And I agree. Still see people, posting or calling me or whatever, I've got an emergency.
Yeah.
Live actual emergency. Yeah. And they're telling me it's a 12-hour wait to
get
into my emergency clinic.
Yes. Yep.
Talk to me about that. Talk me through.
Yeah.
That. Talk me down off the cliff on that.
I'm gonna talk you off the ledge with that one. And we saw this, like you mentioned, very much during the pandemic, where it was twofold. It wasn't that all of a sudden pets started having more emergencies. Right. What took place is that people started having more pets, and there's been so much information that cites, obviously, the reasons why people started gravitating towards shelters and rescues and, purpose-bred, pets, however you wanted to obtain your pet, everybody started looking at this opportunity to bring companionship into their homes, right? And so as a result of that, the vet med world completely exploded as far as now having all of these patients, right? And all of these families that we had to take care of. Emergency probably suffered the most in that because, a lot of times in general practice, they run off of appointments. Sure. And if they're not seeing walk-ins because their staff is limited or their schedule is limited because they also have to do surgeries and other stuff, then they're automatically getting on the phone saying, don't bring your pet here, you got to go to ER. So now everything was being filtered to these facilities that didn't have appointments. And then that's when you would see the stacked on wait time. What I like to tell people, my friends, my family, anybody who will listen, is as much as I know how annoying and frustrating it is to have to wait for an exorbitant amount of time in an emergency facility, it's always better to be the pet parents that have to wait versus the ones where things are being shuffled through. And what I mean by that is, in the emergency room, we're prioritizing severity with patients. And so if we have a patient that's coming in that's high priority because they're actively dying or, having difficulty breathing, they're going to bypass the ear infection, the diarrhea, the limping.
Ate my gummies, sort of.
Yeah. Yes, right. Depending on how many gummies, we might actually scoot that one a little bit closer to the front so we can help them through that. But what my take-home message is that I know that it can be so frustrating to wait, but I always say no news is good news. The longer you're waiting out there, the less likely your pet is actually trying to leave this earth. Yeah. So
that's actually a really good perspective.
Trupanion is revolutionizing medical insurance for pets by providing the best possible experience to our members. And it's not some space-age dream. It's happening now. We pay your veterinarian directly while you're checking out, and we're the only ones who can, which means you have decisions in seconds, and you don't have to wait for reimbursement. So unlike with other providers, you'll keep more money in your pocket. Ask your veterinarian if Trupanion can pay them directly, because there's pet insurance, and then there's Trupanion.
I've been fortunate. I like I said, I have a really good facility. It's a long way away, but it is a really good facility. And I've had to use it occasionally for, usually breeding stuff like an emergency C-section after hours.
Yes.
But I went through a really really seriously hellish situation earlier this year. And
sorry.
Yeah, no, it was really bad. And it was exacerbated by the fact that it was during a veterinary conference.
Oh.
And there were no surgeons.
Yeah.
Anywhere to be had. No boarded surgeons. And this was a situation that was a dog that I wound up losing. He had, as it turns out, he had TCC, transitional cell carcinoma, his blood, and really gross.
Yes. Yes.
And dealing with the emergency staff on that level. Like, I really am losing my dog, and I'm not losing my dog with my personal veterinarian.
Yes. I know. I do.
You have that relationship with your personal veterinarian and making those horrible things, and it is gut-wrenching and awful.
It is.
And it is 10 times, I promise you, 10 times more gut-wrenching and awful when you're with complete strangers.
Yeah, people you don't know. Yeah.
Well, you don't know the people, and I mean, the staff, really, truly everyone was as wonderful as they could be.
Yeah.
But it's not the same. And so talk us through, what as a pet owner, right? As my dog is sick and I have to deal with this.
Yeah.
What are your recommendations to me, to our listeners that are dealing with this situation? Do you have insight, advice?
I do.
Okay.
Yeah, I have a lot of things to say about this. And first, I want to say, Laura, that I totally empathize and sympathize with your experience that you shared. And I know how scary and how heartbreaking that was to have to make those decisions. And especially, like you mentioned, to do this with not your family vet, but with people that you literally were just meeting on the spot. So I will give you a little bit of a secret. Many of us veterinarians have also been on the other side of the table with that, where we have had to not bring our pets to our colleagues, but because of the emergent scenario, having to go into a scenario, a facility where we didn't know folks. And so I 100% have been there and can feel that so much. My recommendations in these scenarios, and it's a couple of different approaches to it. I think the top one is just reminding yourself that vets who are in emergency medicine and the vet professionals and the vet staff, they are highly trained and competent to take on these types of cases. And sometimes it doesn't feel that way because we're talking very quickly. Our bedside manners can be a little bit, it can be interesting sometimes in an emergency scenario. And so it will often leave pet parents feeling less confident and our capabilities. But I want to make sure that you know and empower you and those who are listening that these folks in these scenarios are highly trained. And so trust in that. The second recommendation—
I will say, not to interrupt, but that's a super hard one.
It is. It's of course it is, especially when you've been going to your veterinarian for umpteen years, right? And they have sat there with you and walked with you from puppy to senior to kitten to whatever. It is such a challenging space, but just this is my reminder to anyone who needs to hear this is that I promise you these folks are highly trained and competent. And we are there to do whatever we can to save lives. Your pet's life and it being saved is it's got to be our top priority. This is what we're trained to do. And so even though it may not come across that way, because again, things are moving very quickly, that is always going to be at the top of our list of, our importance and significance is to save your pet's life. The second thing that I will mention too is that many of your general practitioners have very good relationships with emergency veterinarians. And so if you're in a situation where you haven't had to visit an ER clinic yet, I would encourage you to talk to your regular vets and get a little bit more insight into who do you recommend in the area? Who's your favorite? What is your experience? What's your step-by-step approach for my pet if I need an emergency, right? So these are conversations that you guys can start having even before an emergency arises. And I feel like that sometimes takes away the mystere of going into this facility that you've never stepped into. My third recommendation is, if you have a moment, go into these facilities. Say, I'm just stopping in. I hope that I never have to see you ever in life. But just in case, do you mind giving me a tour of this place? Like, I would love just to grab a pamphlet, grab a magnet, whatever. Let me just understand what's happening behind these closed doors. And so I just feel like anything that you can do preemptively or proactively may really help in those very scary situations.
So here's another one for you. And I personally know people who've had negative experiences. My experiences have been really positive, but I know it is an issue. Talk us through. I have a bitch in labor. It's 1:00 in the morning.
Oh yeah.
Clinic goes,
oh yeah.
This is an emergency. Like literally everybody's gonna die.
Yes.
And you go to the emergency vet, and they're like, the only way we do the surgery is if we spay your bitch. I'm sorry, it happens.
Okay. There's a lot to say about this.
I understand, and I don't want to start a fight here, but I really need people to hear something on this.
I will tell you this. Let me provide some context to this too. I will be very transparent about my pathway and journey to my relationships with breeders and breeder enthusiasts. I will be very honest that a lot of times veterinarians don't have the best relationships with breeders. That's a given. I'm not telling anybody anything that they don't know right now. So, it just across the board, there seems to be somewhat of a communication breakdown or a barrier for many within the vet world and in the breeder world or breeder enthusiast world. That's a fact. Prior to me working with Purina, I've sat in that category because majority of the breeders that I met was exactly what you're describing, on emergency, coming in with a lot of knowledge, but then also with an experience that they had previously that was now kind of dictating how they were going to experience our time together. And that was already putting up somewhat of a wall. Right. So again, that communication breakdown. It wasn't until I started working with Purina and I gained access to breeders from all different walks of life, backgrounds, personalities, where I recognized that you guys were not monolithic. One breeder wasn't like everybody else. There's going to be really great responsible breeders, and then there's going to be some that probably shouldn't be breeding. We all know that. And people will say the same thing, like there's going to be some veterinarians that are excellent at communicating, and then some that may just need to be working in a laboratory. So
I've met a couple of those. Yeah.
Right. So I think we can all agree on that. And so when we're talking about like a specific scenario, like a dystocia, a pet patient that's coming in that's having difficulty giving birth, we all have like a stepwise approach to this. And when we look at that particular breed, and we might gain information from the pet parent, like how many times have we been bred? How many pregnancies? Like we're taking this information to understand the risk factor of that particular patient. And if we hear that there's a lot of risk associated with the continued breeding of that pet, then it is, from an ethical standpoint, our responsibility to recommend a way to prevent future issues. And a way to prevent future issues for those higher risk scenarios is to offer up a spay. So
I get it. I get it. On the other hand, when it's a policy matter,
yeah, I have not worked, so I can't speak to that because I have not worked in a facility where policy wise, the only way we're going to do a C-section is if we spay. I've never done that. I've done many C-sections. I would say half of them I have probably spayed, and the other half I have not, so I would, some of these facilities that have this policy, it may be based upon data or information that they have received from the types of patients or clientele that they're working with. But in my scenario, I have not been forced to have to make a decision. It doesn't stop me from making recommendations though. And at the end of the day, if I make a recommendation to a pet parent, I'm making it because I truly believe that it's the right choice. And it's going to be up to my pet parents and the relationship that we have built for them to receive it. And if they walk away and say, you know what, love you, Dr. Callie, love that you saved my pet's life, love what you're talking about, but no, I'm not doing it, then I'm going to do everything I can to make sure.
I mean, it has happened to me where I've brought in my actually foundation bitch and wire hair pointers to a clinic that I had set up the whole thing with, but the actual doctor I'd been working with was on vacation, of course, because
that's how it always happens. Listen, this is always how it happens.
Always. And the first words out of her mouth were, "Do you want to spay her?" I'm like, no. No, this is like, I've been planning this. I have plans for the future. And so what are your best words to give my listeners who all of whom have been in some level of this experience? Who have hours and years and untold emotional and physical and all the rest of it invested in this, and someone just looks at them and says, okay, well, we'll need to spare. Like, how do we, what's my vocabulary? Because my vocabulary, I will promise you, was not going to be worthy of being on the air.
Okay. We're going to avoid using profanity, right? We're going to avoid.
Sure. I mean, I had to be carried out of the room. So I'm just telling you.
So I would say some words that I would have in my vocabulary box in that scenario. And this, I'm speaking to the understanding of responsible breeder.
That's who's here on my podcast.
Yes, not others. Okay. So I think that when you can, and I don't even want to say when you can prove that you're a responsible breeder, because how do you prove that in that type of situation, right? It's kind of difficult, but I will tend to understand which breeder I'm working with based upon a series of reactions and answers to questions that I ask, right? So when I work with folks that are well-versed in certain conditions, who have financial resources. This is a big one. Financial resources to help support their whomever they're breeding, right? Then that typically leads me down a pathway of, okay, this is not their first rodeo. They know what time it is. They're prepared. And so now we can have a different conversation, right? Vocabulary, going back to that, I think you can always stand your ground, Laura. You can always say, I appreciate what you're saying, Dr. Callie. I recognize that it's probably within policy to automatically recommend a spay, when you're dealing with a dystocia patient. But in all due respect, I work with my primary care veterinarian through my breeding programs. I'm just trying to get through this acute experience. And I promise you, I will continue this conversation with my primary care. You say those words, it's like, okay, you heard what I've offered, right? But you're recognizing that you're not going to agree to this, but you have a relationship with another veterinarian that that you trust, that's also going to help guide you through this experience.
That's actually really helpful, and I wish my 25-year-old me had those words, because I definitely didn't. And so just one other tiny follow-up on this, because I know we're kind of reaching our time here. There's a lot of information and research, and I've also lived through if you could actually just know the Auntie Laura medical mystery stories, you would die.
I feel like you could write a book.
Yeah, there's a book. I promise there's a book on that. Spaying a bitch on the table, which I did. I had a bitch who had a couple of rough situations. blah, blah,
Yep.
blah. Final litter. She has now a torsioned uterine horn. I'm like, for Christ's sake, I can't, not
Yeah.
doing this again. Let's just say.
Yeah.
Well,
Yeah.
we almost lost her. And she actually then came in season, quote unquote,
Wow.
for the rest of her life, because in the process of trying to save her life and the vascularity
Yeah.
that was going on in the surgery, he missed a small chunk of the ovary and cha-ching.
Yeah.
Right.
Yeah.
So the medical information about spaying a bitch during a C-section and all of
Yeah.
the risks that go with that. How
Yeah.
do you address that within the emergency community?
Yeah. Yeah. Couple of ways. I look at my patient in that moment, right? If my patient is coming in and they can barely lift their heads because they've been pushing for a period of time, their electrolytes are off, they're weak.
Yep.
Their lab work is showing changes associated with a difficult birth, right? If I'm looking at the particular breed and I'm looking at their structure and their anatomy, and I'm like, this is always going to be difficult for you, then the risk associated of not going ahead and spaying that patient on the table, the risk of that, right, is going to outweigh any benefit of waiting. Do you see what I'm saying? If I have an otherwise healthy pet that is just having some difficulty, with this particular whelping, has not had a history of it, lab work is not showing me scary things, physically the pet is not showing me scary things, then we have a little bit more room. We have a little bit more opportunity to work through this and give her another chance at this. But if my patient is actively in a place where I'm really concerned about what something like this could do for them and their life in the future, then that's when I'm going to make that recommendation. Let's not try to push this out. And there's always going to be a risk. There's going to be a risk with spaying, even in a healthy patient. We do spays. Or when I say we, general practitioners do spays on a daily basis. I do not spay on a daily basis. But even with routine spays, there's always a risk. When you have a pet that's uterus is 3 times its normal size and engorged with all these vessels, and again, you're looking at these different electrolyte changes, you have to look at your patient in that moment to make the best decision.
Okay, that's good. That's good. All right. Well, Dr. Callie, this has been fascinating. We could go on for hours and hours and hours.
We really could.
And actually, I hope that we will have the opportunity to do so again in the future.
Yes, this has been great because you're asking some really good questions that I know people have either top of mind or have experienced it. And, we need more ways to communicate. And I love what you're doing with your podcast to open up the doorway with that.
We do a lot of this. So I really appreciate your time tremendously.
Yeah.
So, thanks very much.
You.